After this entire controversy, there's been opinions expressed both ways, and Dr. Krishna Ella of Bharat Biotech, in fact, put up a very spirited kind of a defense and said that he's being unfairly targeted and that they are a global company with a lot of experience and that this is proven technology. I'm joined by Dr. Rakesh Mishra, Director of the Centre for Cellular and Molecular Biology. First of all, Dr. Mishra, what do you make of this controversy? Was it warranted at one level that without phase 3 trial results, this vaccine was given the go-ahead, the Covaxin developed by Bharat Biotech?
At this point, when we are struggling to control this pandemic and threats of new variants, new peaks coming, I think news like availability of vaccine is certainly very good news and should be a moral booster. But unfortunately, we are talking this as a controversy. So, which clearly means that there should be more communication, there should be more information, so that the regulatory mechanism which is being followed, regulatory body, I'm sure they have followed their process. India has a strong regulatory mechanism. Many times regulatory bodies are criticized for delaying, for asking for more data and so on. And in this case, they have followed procedure, I understand, because you cannot do something which is not within your procedure. Maybe always more data is better because that gives you more confidence. And we are talking about vaccine during as an emergency utilization approval. So this comes with a lot of conditions. It's not approved vaccine. None of these are approved vaccine. All the 4 or 5 of them which are there approved by the different countries, they are used only for emergency usage. So that should be put in perspective and a lot more data. Please remember that in a year we are having vaccine which is being made available to people is something unprecedented and never happened. I mean, thanks to the progress in the science and technology that we have reached at this point. But what science and technology cannot accelerate is the time that you give the vaccine and wait for people for 6 months, 1 year to know long-term effects or long-term protection of the vaccine. So that simply data is not there anywhere. That is why these are called emergency usage approvals. If person gives a consent, if it is really necessary, then you can use this vaccination alternative that you have, and it's probably a good tool for available to us for fighting this pandemic.
Dr. Mishra, you have been someone who has always said that vaccine is obviously not the solution and the more traditional methods of mask and social distancing and washing of hands is much more effective. But do you feel Bharat Biotech in a sense was unfairly singled out for criticism? Because like you're pointing out, it's probably the same for every vaccine out there, including the 2 vaccine candidates that India has approved. Technology-wise, I would also like you to comment on on the technology that's been used by Bharat Biotech as opposed to the messenger RNA technology that other vaccines seem to be employing.
So the mRNA messenger RNA technology, which is used by Pfizer and Moderna, are a new technology. They're really, I mean, I would love that becomes the future of vaccines because that's easy to make, very easy to make variations of that vaccine. And there are many other positives in that vaccine because you make a body to produce the antigen in an appropriate way as it produces for when the virus replicates in the body. So maybe more kind of personalized, I would say, antigen or vaccine is produced in the body and that's presented to the immune system, which then protects oneself. But that's very new technology. Nobody has, it has not been tried in the people. While in India, this Covaxin and Covishield, these are established protocols. There are successful vaccine stories in them, and both these companies are very strong players. They are powerhouse for vaccines, and they have been in this for a very long time. And I would think maybe data and trials, Bharat Biotech is maybe a month or 2 behind other things, but otherwise, they have similar kind of. I would like to just first say that if you are given even a stage 1 trial, that means there's reasonable confidence in the regulators that it is safe. You cannot inject people something which will harm them. Then you ask for stage 2 trial. That means you really are now more confident. And stage 3 trial, I would assume that regulators and the data is convincing that this is safe vaccine. Now, so safety-wise, I'm not sure there should be any issues. If it is not safe, it cannot be given to tens of thousands of people at the risk that even 1% of them may get harm. I mean, vaccine will have some local issues, some irritations, fever, and those things. That's a normal thing. And some with allergic thing may respond more. That happens with any vaccine. But I think we should trust the regulatory body that it is safe. How efficacy and how long its effect will be on the people. Efficacy we will know slowly as more large-scale vaccination begins, which will hopefully will begin. But how long this protection will be something which will know only with the time. There is no other way up.
Yes, Dr. Mishra, thank you so much for sharing your views. Gargi, back to you with a word that Dr. Krishna Ella said. There is only the efficacy will only have to play out as the months go by and as we know how the vaccine progresses. But yes, they do have immunogenicity and safety data, and they are talking about the fact that yes, this is an emergency that we are in. Back to you, Gargi.